Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Venkata Dalai. He is a psychiatrist at Mercy Clinic Behavioral Health in Fort Smith. Dr. Dalai, thank you for being here today.
Thank you very much. Thank you for having me.
So we're talking about treatment-resistant depression and TMS. Tell us what that is and how does that work?
Sure. So before going into the TMS, the details into the TMS, I would like to briefly tell about what is the treatment-resistant depression. I would say it has two different definitions. On textbook, if somebody who had 2 adequate medication trials and still having the depression symptoms, we can consider those patients as treatment-resistant depression patients. It's completely different when it comes to the practical aspect / insurance approvals. There are different groups of different antidepressant medications, and the patients have to try at least one medication in each group, and they also have to try some additional treatment augmentation strategies such as combination of the medications or medications in combination with the psychotherapy. But still, if they're having the depression symptoms and struggling because of the impact of the depression, we can consider those patients as treatment-resistant depression. So that's the basic definition of the treatment-resistant depression. So I started working here at Mercy Clinic in 2019, and the one significant thing which I saw in my patient population, by the time they reached to me, they have already tried 4, 5, 6 different types of depression medications, and they're still struggling with the problem. So that's what kind of made me to focus more on what other options we have, what else we can do for the patients. So TMS is FDA approved back in 2008, but it's not completely available in a lot of rural places and in small towns. But all the past, I would say 7 to 8 years, it's been more available, and it's been helping the patients of this particular disorder, treatment-resistant depression. It's been helping really good. And to answer your question, what exactly TMS is transcranial magnetic stimulation, the abbreviation, which is basically a non-invasive FDA-approved treatment option for TRD, treatment-resistant depression, in which we use a specific magnet that's going to be gently located on the scalp, and the magnet is going to deliver the magnetic pulses to stimulate the nerve cells, which are less active in this patient population. So that's what the TMS is.
And it's considered a promising option for people. You have seen good results with it?
Yes. So the remission rates, or the response rates, I would say, the response rates with the help of the medications is around 32 to 35%. And that is the reason why a lot of patients, even though they have some kind of response to the depression medication once they start on the medication, but still the symptoms may relapse faster. When it comes to the TMS, the response rates are around 60 to 65%. So we're actually doubling the chances of these patients to get better, to feel better, and even the relapse rates are, compared to the regular antidepressant medications, the relapse rates are pretty good for TMS.
And can you describe the kind of patients who are most likely to benefit from TMS?
Yes. Like I told you at the beginning, this is a very, very good option for treatment-resistant depression. If somebody who tried one SSRI, selective serotonin reuptake inhibitor, which are basically Zoloft, Prozac, Celexa, Paxil, Lexapro, one of those medications, and one medication in the group of SNRI, like serotonin norepinephrine reuptake inhibitors like Effexor, Prestige, Cymbalta, and one treatment augmentation strategy. So using a medication such as the Zoloft or Effexor of one of these group medications. Along with that, if we try a different medication like a Wellbutrin or some of the new atypical antipsychotic medications which are also FDA approved for depression treatment, if we combine two medications and still having the depression problems, probably we can consider those patients as treatment-resistant depression patients, and the insurance companies may approve the option of TMS, and they are very good patients for this treatment.
And what does a typical course of TMS therapy look like for a patient? Is it sort of a one time or every 6 months? How frequent? What does it look like?
Okay, so the current approved treatment protocol is in this clinic. What we have been doing is on day one, we do the TMS mapping. That means I'm going to use a standard protocol and I'm going to try to find the location of the brain where exactly we target. All the functional MRI studies on the depression patients showed that there is a particular part on the left frontal cortex. It's called left dorsolateral prefrontal cortex on the left side of the scalp in the front side. That's the exact location which is actually less active in these chronically treatment-resistant depression patients, and that's what the location we have to find. So I use the protocol and I try to find the location, and and also at the same time I try to find how much magnetic strength we have to use for that particular patient. So it's called mapping, and that's going to be one session. And after mapping, we recommend the patient to come to the clinic Monday to Friday, 5 days a week for 6 weeks continuously. So it's going to be 30 sessions. And followed by seventh week, we're going to do 3 sessions. And 8th week, we're going to do 2 sessions. And the last week, we're going to do 1 session. So total of, we're talking about 1 initial mapping session and 30 follow-up sessions and 6 tapering sessions, total of 37 sessions. And on top of that, each session is going to be either 3 minutes or it's going to be 19 minutes. But it depends on how much of the magnetic strength we have to use. If we have to use for example, if we have to use a lesser magnetic strength, we can do the theta bursting TMS, which is basically the magnet is going to deliver multiple pulses at the same time in a faster way, and that will be done within 3 minutes. But if we have to use a very high power of the magnetic strength, we have to go slow for these patients, and it can be done within 19 minutes. So we always give the patients in this clinic, we give them half an hour slot for their treatment session. And the patient will come every day around the same time. And they will come in and they will go back within half an hour, including the waiting time and completion of the total treatment session, and then going back to home or go back to work, whatever.
What are potential side effects or risks associated with this type of treatment?
So it is, as I mentioned before, it is a very non-invasive treatment. So there are some kind of thought process that it could be electric shock or something like that. So it's not. It is very minimally invasive. Actually, it is non-invasive procedure. So the patients can have some mild headache or scalp pain when they're actually going through the session. In fact, that happens very rarely. That's also not a frequent complaint. But that's something which could happen to patients. Other than that, they might have some ringing sensation in the ears because the machine is a little bit louder, so that could cause the ringing sensation in the ears. Again, while going through the treatment, but not after the treatment. There are no case reports about having a seizure because of the TMS, but seizure could be one of the potential risk factors, but it's kind of extremely rare. Over the past 3.5 years, I never saw any patient experiencing seizures, but that's one of the documented side effect from the procedure.
And is this a permanent solution, or do patients sometimes need booster sessions?
Um, Again, we have to look into the whole picture of the depression. Depression is a chronic, relapsing, and remitting type of problem. If somebody has diagnosis or like got in depression for the first time in their life, the chances of recurrence is 50%. And if somebody got like two major depressive disorder episodes, the chances of getting a relapse is 70%. And if somebody got more than three episodes of depression in their lifetime, the chances of getting depression back is around 80%. So, to be honest, there is no permanent solution for that, but definitely TMS is very, very impressive. Um, with medications, the relapses are pretty high, but when it comes to the TMS, the effect or the impact of the TMS is lasting for several months up to several years. It depends on so many other factors, how much stress they have in their life, what kind of like other medical comorbidities they have, and how much they're bothering and how much they're impacting their mental health. What kind of like other stresses like financial problems or job related problems or something else is playing a role. And most importantly, the genetic factors also play some role in this, because if there is a strong genes passing on, that also could have an impact. And substance use is also very, very, very important factor to consider. So a lot of factors play a role. I can tell the first patient we did in this clinic back in 2022, and we did not repeat the TMS for him. That's a great story. There are some patients who do not need to come back like maybe in 2 years, 3 years, but there may be some patients who may have the relapse of the symptoms in 6 months also. But definitely it is much promising treatment option than the medications, and the impact may last for months up to several years.
Is the treatment covered by insurance, or is a cost barrier there for most patients?
It depends on are you meeting the criteria or not. It's not for everybody. Definitely somebody who do not try any medications and do not want to take medications because of the fear of side effects would like to get the TMS, it's not going to get approved by the insurance. But majority of the insurances, including the Medicare, they cover the TMS pretty well. All we have to make sure is the patient meets the criteria or not. They have to try a minimum of 2 adequate medication trials with one more combination medication treatment, and then they are eligible for the treatment. And like I said, most of the insurance companies approve it. Out of pocket is definitely expensive for this treatment.
Are there misconceptions about it? Is there a stigma involved? I know that treatment-resistant depression has a lot of misconceptions.
Yeah, absolutely. So the most common misconception and the most common question I get from my patients is this a shock treatment? It is not a shock treatment. It is something which is completely non-invasive procedure. It is not painful, and you do not have to get any kind of like anesthesia, or it is not a surgical procedure. It is considered as a procedure, and it could cause mild scalp pain, but it's not a permanent problem. And on top of that, we don't have to use anesthesia. We don't have to do it in the inpatient setting, and there is no risk involved in this process. So that's one big misconception. So always people compare the TMS with the ECT, the electroconvulsive therapy, which is the shock treatment for depression patients, but this is not a shock treatment. And number two, if it is going to be a procedure, how this is going to impact me with my driving or with my work life or with my daily life, those kind of things. It is an absolutely outpatient procedure, and it does not take much time. We have definitely pretty good functioning patients who receive the TMS. All you have to do is like take permission for that half an hour and come to the clinic, get your treatment, and go back to your work. You can do whatever you want to do. There are no restrictions involved in this process. And also, people think that is this going to be pretty expensive? Do I have to pay a lot of money? Or is my copay is going to be very high? Something like that. As I told repeatedly, if the patient meets the criteria, the insurance companies are approving very well, and it is very well covered procedure.
So, where do you see the future of TMS heading? Are there other mental health conditions that it even could help treat as well?
Yes. TMS, it's already FDA approved for smoking cessation, targeting a different location of the brain. And there is a lot of research going on in patients with PTSD. And I'm pretty sure that it's going to get approved very soon because VA has been doing a lot of research on that because they have the highest population of PTSD. And also a lot of big institutions in the country have been doing their research studies on the PTSD and bipolar depression patients too. And most of the studies are showing like a very prominent results. In fact, I have patients who have a mixed diagnosis, like they meet the criteria for major depressive disorder. At the same time, they have the PTSD history too. And I could able to see in my patient population that very significant improvement, not only in their depression symptoms, but also in their PTSD symptoms also. So that's on the psychiatric side. Also, there are a lot of research studies going on the neurology side. And there was a study that's going on in Australia and New Zealand right now, and they're trying to implement that in the United States, which is basically, is there any kind of like positive benefits from TMS if we stimulate the brain immediately after the stroke in a patient to regain the strength? And so far, the preliminary studies are showing some prominent and very good results too. And I would like to take this as an opportunity to share one of the experience, what I had with my patients, actually two of my patients. Both have multiple sclerosis problem, which is a chronic neurological relapsing and remitting problem. And both meet the criteria for treatment-resistant depression. And at the beginning of the treatment, one of the patients was using a cane, actually both of them using the cane to walk because of their balance issues. And one of the patients has a problem with the foot drop, and because of that, the patient was not driving. After we completed the TMS, throughout the whole sessions, we were able to see that the balance has gotten better, and the patients, both of them, stopped using their cane by the end of the treatments, and the patient started driving back because the foot drop has gotten better, and she got the strength pretty good way. She got it back. So I'm not saying that it's going to be like in everybody's case, but I can clearly see that stimulating the brain tissue has a positive impact, and it's all the electrical activity what runs the whole brain, and sometimes correcting it is making the difference, the positive impact on these patients' lives.
And before we go, there are other treatments really moving forward with treatment for treatment-resistant depression that are not TMS. Tell us a little bit about those, just from your philosophy and how effective those are.
Yeah, the other treatment option, which I would definitely consider for this patient population, who, if they do not respond to the TMS, I would definitely consider Spravato. It is a nasal ketamine. It's a nasal spray ketamine treatment. So ketamine is also showing very prominent results in the field of psychiatry. I know it's used as an anesthesia / pain medication for a long time in the field of medicine, but ketamine also showed very significant improvement and impact in the treatment of the treatment-resistant depression. So far, the only FDA approved form of the ketamine is the nasal spray ketamine. It's particularly one isomer of the ketamine. It's called S-ketamine. There are some ketamine infusion treatments also available in some of the clinics, but it is not FDA approved yet. So far, the nasal spray ketamine is one of the treatment options, which is, I would say, equally impactful like the TMS, and that's helping the patient population very well.
Well, Dr. Dalai, thank you so much for talking about this and sharing your expertise and experiences with us for this important information. I appreciate you being here today.
Thank you so much. Thank you for making me part of this.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.